Tuberculosis, commonly known as TB, is one of the most widespread infectious diseases in the world. It is caused by a type of bacteria called Mycobacterium tuberculosis. TB mainly affects the lungs, but it can also spread to other parts of the body such as the brain, spine, and kidneys. TB spreads from one person to another through the air. When a person with active TB coughs, sneezes, or even speaks, tiny droplets containing the bacteria are released into the air. If another person breathes in these droplets, they can become infected. There are two main types of TB: latent TB and active TB. In latent TB, the bacteria remain in the body but do not cause illness or symptoms. In active TB, the bacteria multiply and make the person sick. Common symptoms of active TB include a persistent cough that lasts more than 3 weeks, chest pain, coughing up blood, fever, night sweats, fatigue, and sudden weight loss. If TB is not treated on time, it can be very dangerous and even life-threatening. But the good news is that TB can be cured with proper medical treatment. Doctors usually prescribe a combination of antibiotics that need to be taken regularly for 6 months or longer. Skipping medicine or stopping treatment early can make the bacteria resistant to drugs, which makes TB much harder to treat. Now let's talk about prevention. The best way to prevent TB is to identify and treat cases early. People who show symptoms should visit a doctor and get tested. The BCG vaccine is also used in many countries to protect children against severe forms of TB. In addition, maintaining good ventilation in homes, schools, and workplaces helps reduce the spread of TB bacteria. Wearing masks in crowded places, covering the mouth while coughing or sneezing, and practicing good hygiene can also lower the risk. It is important to remember that people with TB need care and support, not stigma. Anyone can get TB, but with awareness, early treatment, and prevention, we can protect ourselves and others from this disease. So, take TB seriously, recognize the symptoms, and seek medical help as early as possible. Prevention and treatment together are the keys to ending TB.